If you've suffered iliotibial band syndrome, or better known as IT band syndrome, maybe you're a runner or a cyclist, I can bet you know how painful it is. We want to show you some exercises that you can do to try to overcome it. I'm Dr. David Geyer, orthopedic surgeon and sports medicine specialist, here with my friend and physical therapist at Made to Move Physical Therapy, Yves Gege, and we're going to try to get you through IT band syndrome. Now, if you're not familiar with it, this is an aggravation of the outside of your knee where this band of tissue that runs all the way up the outside of your thigh runs over a bony prominence on the outside of your knee. Really, really aggravating in runners and cyclists. Fortunately, it almost never needs surgery, but it can linger for a while if you don't do something about it. So we're going to show you some simple things that you can do to help you overcome it.
So the first thing that we like to work on with these runners is definitely who gets it a lot for sure, but really anybody can, is get in a position where we can start stretching some of the muscles in and around the IT band, in the hip as well. So this is an exercise you can do easily almost anywhere. You know, you can sit in a chair at home, sit on your couch, pretty darn convenient. So we're just going to use this bench here.
Okay.
All right, just want to have a seat. And then we're going to cross one leg over the other. The thing that's important here, yeah, perfect, is that this ankle bone, everybody knows about this ankle bone. I actually want to make sure it's on the other side of your knee. Once we get to that position, we're just going to gently push this knee down and try to flatten it out. Good. The other thing we want to do is make sure that we're like nice and upright, and maybe even lean into it a little bit. Usually you can feel it.
Yeah, you can feel that.
Right. Now you can start to feel it in your hip a little bit more. Yeah, pushing down anywhere from 30 seconds to a minute and holding it there. Good stretch for that IT band.
Yeah, no, I like that a lot.
Yeah.
Terrific.
Yeah, easy one to do. So the last one is a strengthening exercise. So that knee needs to be in a stable position. That hip needs to get stronger. So we're going to do what's called a single leg deadlift or a single leg RDL. So going to need to work on some balance here. We'll see how it goes, right?
Yep.
All right. So you're going to stand on one leg.
Okay.
Let's do the right one first.
Okay.
What we're going to do here is we don't want to lock out our knee. You can't really tell here with the pants, but we want a little bit of softness through the knee. And then from there, we're going to hinge at our hip and lean forward and let that other leg kind of come backwards. Perfect, and come back up. Just a simple, small range of motion. Sometimes you'll feel a little bit of stretch in the hamstring, and that's okay. Again, this is working all those muscles. I'm sure you can feel that in the hip, in the quad, in the hamstring. Really working on stabilizing that knee, which can help a lot with some of this IT band issues that we're having.
So how many reps would somebody do? What's the time frame of that?
Yeah, I mean, I would say anywhere, I like a little more reps with these, so I would say anywhere from 10 to 15 reps on each side and maybe 2 to 3 sets. If you're really advanced, you can try maybe holding a kettlebell or dumbbell in one hand or the other, it doesn't really matter, and actually load it up a little bit and make it a little more fun.
Okay, and I know it's not an exercise, but I'm just curious. You hear people talk about, both from a prevention and a treatment standpoint, they do like a foam roller, or they do what are those things you use in the kit, the bake.
Oh, yeah,
like rolling pins. I
Yep.
couldn't think what it was. What do you think about that for IT band, especially when you've got tenderness directly on that bony prominence?
Yeah, no, I love that stuff, right? So a lot of it's just sensitivity, right? Just our neurological system it's just painful. So what do we want to do? Maybe desensitize some of those tissues, get on a foam roller, maybe a lacrosse ball, maybe use a rolling pin at home and desensitize it. Anything to kind of make you feel better so you can get out there and be active and be pain-free.
Awesome. Well, IT band something it's not going to be anything you need surgery for. It's, usually going to get better if you work on it within a few weeks. But if you don't, it'll just keep lingering and lingering and lingering. So you have nothing to lose. This 10 minutes a day, every day, a couple times a day if you can, it'll go away pretty quickly. Check Yves out on the social media in the description below this video. He's got all kinds of great information, videos like these, and on all kinds of injuries and injury prevention strategies. If you like videos like this and you have other ideas or other injuries you'd like us to discuss, send that our way and we'll maybe do it in an upcoming video. And we look forward to seeing you in our next exercise video.